Hello everyone, this is Efrain Castillo, a first-year resident at the University of Miami, Jackson Memorial Hospital Internal Medicine Program. I'm presenting this case, cardiac cascade, aortic valve endocarditis leading to multisystemic embolic phenomena and severe cardiogenic shock. So infective endocarditis is an infection of the endocardium that typically affects one or more heart valves. Its incidence in patients with HIV has decreased given the use of antiretroviral therapy. Yet those with new diagnosis of HIV remain at increased risk for severe complications, particularly embolic events. And despite being rare, it is still extremely threatening with an inpatient mortality of around 15 to 20%. We present a 45-year-old female with past medical history of hypertension, prompted by her PCP after she reported a 3-month history of flu-like symptoms. On initial evaluation, she was found to be tachycardic, tachypneic, and hypotensive, with a blood pressure of 95/60. Physical exam revealed minor splinter hemorrhages and a grade 3 decrescendo pansystolic murmur with a diastolic component. Bilateral crackles were auscultated at the lung bases bilaterally. So initial lab work was notable for leukocytosis, anemia, elevated lactate, troponins, proBNP, and new HIV diagnosis. CD4 count was 450. So initial chest x-ray showed multifocal opacities concerning for pulmonary edema, and given these interstitial findings, also multifocal pneumonia is a possibility for which broad spectrum antibiotics were started. Hospitalization course was complicated by worsening respiratory distress, requiring intubation and mechanical ventilation in the ICU. So TTE in the ED showed these big vegetations with some aortic insufficiency that were later confirmed on TEE with some 12 millimeter vegetations at the aortic valve associated with severe aortic regurgitation, and the vegetations were very mobile. EF of the left ventricle was 15 to 20%, and global hypokinesia was noted, for which a non-ischemic cardiomyopathy diagnosis was confirmed. There was also evidence of septic emboli to the coronaries, the lung, with multifocal embolic infarcts, as well as this MRI of the brain showing the cerebellar restricted diffusion defects bilaterally. So after being intubated, the patient still developed cardiogenic shock, rising lactate was maximum of 14, and blood cultures were positive for Streptococcus catalyticus. She required inotropic support, digoxin, dobutamine, and also veno-arterial ECMO. So we started these assisted devices very early on. Despite this, she still continued to develop biventricular failure, for which the cannula was withdrawn 5 centimeters. Palliative care was consulted and multidisciplinary discussions were held during the entire first week. Intra-aortic balloon pump was also added to the assisted devices, given this ongoing cardiogenic shock. Immediate surgical aortic valve replacement was done, and intraoperatively they found a moderate-sized perivalvular abscess managed with a pericardial patchplasty. After that, and the initiation of cefepime, vanc, and gentamicin, the patient later on the second week had no fever, negative blood culture, so we de-escalated the antibiotics, and then we were able to decannulate her from the ECMO. So infective endocarditis should be considered in patients with acute serious native valve, aortic valve impairment and acute heart failure. Vegetations greater than 10 millimeters with severe mobility defined as pedunculated and prolapsing across the valve coaptation plane they can predict embolic complications and mortality near 20%, specifically in the left side of the heart. So the aortic valve complications leading to heart failure are due to valve damage, annular abscess, and myocardic aneurysms. And HIV patients have a more severe disease with higher rates of these complications. So persistent hemodynamic instability, elevated lactate, and escalating vasopressor requirements are key to initiate assisted devices like ECMO and the balloon pump. And approximately 5% of these patients develop cardiogenic shock, and almost 1 out of 2 requires assisted devices. Thank you.